Welcome back. Thank you for staying with us. You know, with a big name like the Cleveland Clinic in our midst, is Las Vegas finally shaking its image as a place you'd probably want to leave for medical care?
Or are the Valley's doctors already top-notch performers who are just getting a bad rap? Dr. George Alexander is a Las Vegas plastic surgeon. He took over as president of the Clark County Medical Society in June, and he's hopeful Las Vegas will emerge as a destination for medical tourism. Thanks so much for being here.
Thank you, Dana.
Okay, you know, one of the things I would say would be crucial in establishing Las Vegas as a center for medical tourism would be faith in our doctors.
Right.
And I remember a few years ago, Public Citizen did a report about our medical board taking action on very few disciplinary actions by hospitals. In fact, we were in the lowest percentage of actions taken. I'm just wondering, do we need to step up our regulatory efforts a little bit to instill more confidence that we do indeed have doctors who are worthy of a medical tourism destination?
Right, and that's a very good question. We listened to those criticisms, and we discussed and worked out solutions, and have been continuously raising the bar in medical care in Las Vegas. Most of our doctors are very high quality, coming from great institutions with an incredible ability naturally, as well as optimal health care. So,
do you think our medical board, though, is doing a good job in weeding out the bad doctors?
I do. It is a process which, as I sit on the Clark County Medical Society, which is different than the board itself.
Right.
But our function is to be dedicated and responsible to our public for their health, patient care, and doctor relationships. So we certainly look at that very much under a microscope, and we've continuously been improving quality care.
Is that something, though, that doctors want to see? Do they want to see better regulation, better regulatory?
They do want high quality. There's no question about that. At our board meetings, which we have monthly, we continuously go around the room amongst our trustees, amongst our university affiliates, and amongst the Southern Nevada Health District as to how we can make it better.
What's being done to step up reporting? I mean, a lot of times you don't find out about these people, and you know, the medical authorities here have not exactly been transparent sometimes. It's been rather opaque in order to find out who are the bad actors out there. I mean, what's being done to shine light on these people quicker?
So, Jeff, the question is, how are doctors?
Well, for instance, one of the things that was proposed by Public Citizen is that medical boards be made up of half doctors and half citizens, so that you don't have the tendency for doctors to protect their own. Do you think that that's a good change?
I think that's a great change, yes. It needs to be transparent. There need to be physicians involved, even attorneys involved, and citizens involved. No question about that, to assess quality care. I agree with that completely.
You know, we sit here, what, several years after the huge hepatitis scandal that really was a real setback to just the image, exactly. Your assessment of how we have recovered from that, not only nationally, but locally. I mean, do you think that the people in this valley trust the doctors in this valley?
Well, at this point, you know, 4 years ago that happened, that hepatitis issue. And that was looked at under a microscope by medical groups, government groups, attorney groups, and we said, we're not going to let this happen again. And just recently there was an honor reform meeting in Las Vegas that kind of discusses the teaching point of one needle, one syringe, one time. Kind of that's the message, and not only is it a local message, but it's a national message. So as a Clark County Medical Society member and trustee, we've discussed issues related to safety, safe injection practices. We've communicated with our universities, with our other doctors, colleagues, nurses, and medical practitioners. So that's something that we never want to see again, never want to have again. So I feel confident in that safe improvement.
We will let that be the last word. We are out of time. I want to thank you very much for your time today. Appreciate it.
My pleasure.
All right. Well, thanks to new technology from Bally's, a day at the races is as close as the casino floor. We're going to tell you about that when we come back.
And the walls could be about to come tumbling down at the Harmon. Don't go away.